Hey everyone, welcome to episode 6 of the Eidsvig Episodes Health and Fitness Podcast. Today's topic, we're discussing the top 3 shoulder conditions that I see the most with active individuals, as well as people that deal with chronic shoulder pain. So join me today and let's dive into how this topic can impact your health and sports performance. Hey everyone, and welcome back to the show. Do you or someone you know deals with debilitating shoulder pain that robs you of a healthy and pain-free lifestyle or impacts your athletic performance during the sports you love to play? Well, what we're going to be going over are the top 3 shoulder conditions that I see in private practice that impacts millions of people worldwide. We're going to be discussing rotator cuff strain sprains. We're also going to be going over frozen shoulder. And then lastly, we're going to be discussing labrum tears. So what we're going to be going over are, of course, the root causes, why these shoulder conditions happen in the first place. We're also going to be going over the signs and symptoms to look for. Then we're also going to be going over how do we functionally test or diagnostically test to get a proper diagnosis of these conditions. And then lastly, of course, what are the proper treatments that we need to perform in order to find resolution to these 3 shoulder conditions. So let's go over the rotator cuff strain sprain. Now, this is a common rotator cuff injury that impacts millions of people worldwide. And I would have to say this is the most common one out of the 3, just because of how prevalent I've seen this in my private practice and just how easy these shoulder conditions can occur. So let's go over a rotator cuff strain sprain. What exactly is that? So when we look at anatomy of the shoulder, what we have is the rotator cuff. So that is a muscle group, which is a variety of muscles that control the shoulder itself. They allow for proper movement. So the shoulder has the most amount of movement out of any joint in the human body. So it has to have a lot of control and a lot of stability to withstand pressure and load like we've discussed in other shows. So the rotator cuff or the ligaments in the shoulder are the stability and movement factors that we need to have for proper healthy shoulder function. And so when a strain sprain occurs, which a strain impacts the muscles and tendons, which, just so you guys know, the tendons attach the muscle to bone, so that's kind of the anchor system. And then the ligaments are the glue, is what I like to say. They kind of hold the joint in place. So when there's any disruption or injury to these regions of the shoulder, then that is whenever a strain sprain occurs. And so what actually happens is a tear occurs. Now, those tears can vary from minimal to severe. So minimal is going to be just little micro tears, and a little bit of inflammation may occur to the point where, it's a little painful. I can't sleep on it, or it kind of hurts a little bit. It's kind of sore and achy. And then severe, I can't even lift my arm past 90 degrees, or I can't even sleep at night, or I can't even function because my shoulder hurts so bad. So those are going to be the varying degrees of a strain sprain. And of course, a sprain is going to be more particular to the ligaments of the shoulder, which can disrupt the overall stability. So we'll go over into that a little bit, but the rotator cuff strain sprains generally occur in the teenage to elderly type ranges. So it doesn't really impact younger kids. And I have a lot of patients ask, well, why don't younger kids have this? And it's simple. They don't have any fibrous adhesion in their rotator cuff tendons or ligaments. Their ligaments and muscles and tendons are so flexible that they can sit there on monkey bars, which I like to use that analogy. Hey, you don't hear Johnny, the 8-year-old, tearing his rotator cuff on the monkey bars at school. No, because he has the flexibility that his shoulder needs to withstand the load that he's applying in his shoulder. Versus as we get older and we repetitively overuse our shoulder with whether it be sports or daily life, then you're going to be causing a breakdown or a fibrous adhesion formation inside these muscles and tendons and ligaments of the shoulder. And so then what does that lead to? That leads to shortening, tightening. And so then if you exceed or you jolt your shoulder, or let's say you're working out and you put too much weight up and you exceed what that muscle can handle, it's going to tear. And that's exactly what a strain sprain of the rotator cuff is. And so signs and symptoms, of course, sharpness, stabbing, aching, throbbing, just to name a few. That's going to be mostly what you're going to be looking for. And we're going to be diving into a little bit more of how we test that here in a sec, but wanted to just go ahead and just start with the strain sprain, just get you guys oriented of what that is. And now we're going to go into the frozen shoulder. Now, frozen shoulder has a triad or 3 types of underlying root causes of why it would occur in the first place. So let's dive into frozen shoulder a little bit more in depth. So what exactly is it? So the medical term for frozen shoulder is adhesive capsulitis. So let's think about this, adhesive. So what would be adhesive? Adhesion, right? Fibrous adhesion, scar tissue. And so that's the premise of why you would, from a physical standpoint, develop a lot of inflammation or tearing of the capsule, which is the deep ligament of the shoulder. It kind of surrounds the ball, kind of holds it and keeps it stable, like we discussed a little bit ago. And so if that ligament tears and becomes inflamed, then you get the capsulitis. So there's the adhesive capsulitis. So the scar tissue tears and the ligament tears because of the scar tissue buildup, and then you get inflammation to the point where it's high grade, which means that you deal with a lot of inflammation. And then the body's like, we are not moving this thing. I'm shutting it down. And that's why a frozen shoulder is exactly what you think of, frozen shoulder. You cannot move it because the body is protecting it because of the high amount of inflammation and injury that has occurred. Now, let's go to the other two. So we got one, we got the physical component, the fibrous adhesion component. Number two can be metabolic. So what that means is that you can have type 2 diabetes, which is very common all over the world. You can also have a thyroid imbalance, so hypothyroidism, more likely hypothyroidism, and that's going to create inflammation in your joints to some degree. Now, that can vary depending on how imbalanced that is. And so also an ability to heal. So diabetes, type 2 diabetes, people have a really hard time recovering or healing, and so then they're more prone to getting inflammation in their joints. Now, the third is going to be food sensitivities. Now, this is something that I've come across just from the 14 years of practicing, that a lot of inflammation that occurs inside of our joints can be from the foods that we are consuming. So at my practice, we like to run what we call IgG food sensitivity tests. And this is from the Great Plains Laboratory, which I'll link up in the show notes. And that is a test, a blood test that will, and it's just a prick of the finger, and we do that here in the office, and we send that off, and they will test top 93 foods that are most commonly impacted with most people. And so it will give us an idea of how much inflammation from a low, moderate to severe scale within 72 hours of eating a certain food. And so, I've seen people come in, they're triple what a high number would be in their dairy or their gluten. And so if they're consuming that on a daily basis, that's a lot of inflammation that's pooling into their joints. And so then what are you more prone to having? These weird, sudden shoulder conditions like frozen shoulder to occur. And so what are the signs and symptoms to look for? One, of course, inability to move your shoulder. It happens abruptly too, potentially. It can happen gradually, but more often abruptly. Actually, what you're also going to be looking for is sharpness, stabbing, throbbing type symptomatology. So that's some of the symptoms to look for with frozen shoulder, as well as an inability just to, move it or sleep on it as well. So let's dive into the third one, the labrum tear. Now, this is the least common of the three. And the labrum tear is what I found with people that have a degenerative shoulder or a sports-specific injury. And so a labrum, I like to call it the O-ring. What it is, it's a cartilage-based material that holds the ball in the socket of the shoulder. So it's the stability. It's the main stability force other than the rotator cuff muscles and ligaments. And so if we have, of course, too much load or we land with an outstretched arm, then what can happen is you can tear that labrum. And when that occurs, you're going to be dealing with a number of symptoms such as clicking, decreased range of motion, decreased strength, so weakness, and you're going to be dealing with a high amount of instability. Now, I recently had a kid, he was probably 15 years old, and he was a great baseball player, and came to me, and he actually had to stop playing because he tore his labrum, and he couldn't even run without having to hold his shoulder, his arm, to keep it in place. Now, the poor kid, dealt with that for years, and we finally got him to the right physician who administered surgery. But, this poor kid, couldn't even keep his shoulder in place, in socket, because of how torn his labrum is. Now, that's a severe case, but that just shows you how unstable the shoulder can become with a labrum tear. So let's dive into, of course, the root causes of these three conditions. Of course, we'll recap those. One, the fibrous adhesion, which we discussed. Two, the metabolic and food sensitivity issues. And then, of course, the trauma, which we discussed just now with the labrum tear. So those are the root causes. Now let's dive into, okay, how do we functionally test for these conditions? And also, how do we diagnostically test? So, and when do we do those? So let's dive into the functional test. Now, integrative diagnosis, we like to use the shoulder abduction test, which I'll link that in the show notes for you guys if you want to look that up on YouTube. And what we're looking at is a test where we have the patient standing and their arms are going to be locked out, elbows locked out. And you could do this yourself. You could test this yourself. I absolutely want you to. And your palms are going to be facing in front of you always, so out to your side. And I want you to bring both arms all the way up to the side of your head. Do not bend your elbows. Do not bring your hands together. I don't care what your hands do, but bring your arms up. If you cannot bring your arm to the side of your head comfortably, then you have a problem. And if you do have a restriction, let's say you cannot do that, then what we do is we measure that. So that could be 3 inches, 2 inches, 1 inch. I've seen up to 8 inches of restriction. And that is a sign of more of a rotator cuff problem, right? The rotator cuff tear like we discussed. Now, if we do that functional test and the patient can barely lift their arm up to 90 degrees and they're having an extensive amount of pain, then what we're looking at is a complete tear potentially of the rotator cuff. So the muscles and tendons are in 2 pieces, or frozen shoulder, like we discussed. The patient just has a high amount of inflammation and, like we discussed, the metabolic, the food sensitivities, the fibrous adhesion, one of those 3 can be causing that frozen shoulder. And then, of course, labrum tear. If the patient does that functional test with the shoulder abduction test and they have clicking or their shoulder feels like it's about to pop in and out of place, well, then, of course, I'm thinking, hey, labrum tear, of course. And so that's something I want you guys to test yourself. Do that anywhere. You can do it anytime, anywhere. See how it feels. And if you find that, hey, that my right side, let's say, for example, doesn't feel the same as my left, then you guys need to go and find a practitioner, such as an integrative diagnosis practitioner or healthcare practitioner that is close to you that deals with this type of injuries, and get the proper treatment, which we'll be going to here in a sec. And then also we're looking at the scapular elevation depression test. Now that's something that we like to do in integrative diagnosis after we've applied the right treatment and the other test, the shoulder abduction test, is completely clean. Now, what do I mean by clean? I mean full range of motion. I mean no pain. You can bring your arm up with it locked out and no problem. And so the scapular elevation depression test is a test where you're going to bring both arms up, bring your hands together, elbows locked out, and you're going to raise your hands towards the ceiling and then bring them back down and then go up one more time toward the ceiling. And we're going to measure that. In that test, you should be able to lift your shoulder blades 2 to 3 inches up. And if you can't, then we have a problem. We have a fibrous adhesion problem, and we need to remove that. And so that's the other test that we like to do in integrative diagnosis, just to see exactly how well the shoulder is functioning. So if these 2 tests that I just gave you are clean, then you will have a hugely improved shoulder for years to come down the road. So those are the functional tests I want you guys to do. Now, do not do the scapular elevation depression test unless you have a clean shoulder abduction test or bringing the arm to the side of your head. Okay, so that's something I want you guys to look at. Diagnostically, so what are we looking at? What are the gold standard tests to determine or diagnose these conditions a little bit more extensively from an internal aspect? So I like a shoulder arthrogram. That is I believe, the gold standard to doing any sort of MRI of the shoulder. I don't even do the other MRI without dye, just because, you only have an 84% chance of catching a labrum tear. And these are radiological guidelines. And then you have a 96% chance of catching a labrum tear with the dye. So the arthrogram, just to let you guys know, is a MRI with contrast, or dye that they inject in your shoulder. And so that dye, what it does is it pressurizes in the joint. And if you have a labrum tear, it's going to leak into the joint. So the radiologist is going to be able to see, hey, there's a tear right there because the contrast is leaking outside of the joint. And so if you don't have that contrast, then it's really hard for the radiologist to diagnose your labrum tear of your shoulder. So if you do go see an orthopedic, or you do go see a integrative diagnosis provider or other type of provider that you feel comfortable with, then ask them for an arthrogram. If you feel like, hey, I think I may have a shoulder problem. It just hurts all the time. It's not getting any better. I've never had an arthrogram performed yet. I've only had an x-ray, for example. Get an arthrogram. It will really tell you a lot. It will give you all the details. It will tell, hey, do you have any tearing of your rotator cuff? Do you have any arthritis? Do you have any labrum tears? Do you have any inflammation? It will just give you everything you need to know to properly diagnose your shoulder condition. And like we discussed on this show, you have to get to the source of the problem. You have to get diagnosed properly. And then, of course, you have to apply the right treatment once you establish the right diagnosis to evenly distribute the load and the capacity. Those have to be nice and equal. If you have too low capacity, too high load, you're going to have injury. And so we need to bring that capacity up, and that's going to be with the treatment. So that's what I wanted to discuss now. So what are the treatments for these 3 shoulder conditions? Well, one, rest, ice, compression. Of course, that's going to be in the acute phase. If you tear your rotator cuff, we definitely need to get that inflammation down. That's something that I definitely recommend. Steroid injections, frozen shoulder, labrum tears, I believe those are really good too. I mean, I've seen great results with people coming in. They get their shoulder injections performed, just calm down that inflammation, and that really helps just get the patient more comfortable, so then I can go in there and get that fibrous adhesion out of there and restore normalcy back into the rotator cuff or whatever damage has occurred in the shoulder. Now, of course, we got manual adhesion release, and that, I believe, is the gold standard for removing that fibrous adhesion. Now, I'll link that up in the show notes under integrative diagnosis. And I'll actually give you guys some videos to watch on manual adhesion release and why it is so impactful in fixing shoulder conditions. I had a shoulder condition. A lady came in and saw me, great athlete. And, she came in and she does HIIT training classes 4 days a week at Body Machine Fitness, which I'll link that up as well. It's one of the best HIIT training classes in the DFW area. And so she does it 4 or 5 days a week. And she's like, I've been dealing with this shoulder condition. It just won't go away. It just will not resolve. And so we tested her. She was, 6 inches away from her head. And then we treated her once. She went down to 2 inches upon re-examination. And then we treated her the second time this week, and she went down to 1/2 inch. And I mean, she's just elated. She can actually start moving her shoulder, and she's been to, all kinds of different practitioners and had steroid injections, and nothing really worked. So, this manual adhesion release, getting that fibrous adhesion out is just so impactful in terms of getting health back into the shoulder and strength back into the shoulder and range of motion back in the shoulder, everything you need to be able to work out and lead a healthy lifestyle. So I'll link some video on integrative diagnosis. That way you guys can really get an idea and dive into that a little bit deeper. Then also what I like to discuss, integrative dry needling. Now that's another technique that I like to employ. Now we like to utilize dry needling as a means to loosen up the rotator cuff. So if you have a spastic muscle and it's trying to guard, or it is reactive to a trauma, we need to reset it. And that's what I like to blend the integrative diagnosis as well as the integrative dry needling, just to loosen up that tissue so I can get a little bit deeper and get that scar tissue out. So I'll link that up in the show notes as well. And then we also got laser therapy, which is the hot laser therapy we employ here at the office. LightCure, one of the best out there. I'll link that up as well. And that is something that a lot of practitioners are now starting to employ in their practices, whether it be PT, whether it be ortho, whether it be chiropractors. And I think it's just fantastic. I mean, laser therapy, it's safe, it's so effective, and it reduces that inflammation, and it just gets in there and heals from a vascular and cellular level. Then also what we're looking at is PRP stem cells. Now, this is kind of the latest thing, and I really love it. I think, I applaud doctors out there that are using this, because you're using the natural stem cells and growth factors that our bodies need to heal. So you're just accelerating that. So what they do is if you're looking at PRP, you're looking at platelet-rich plasma injection. So what they do is they'll take your blood, spin it in a centrifuge, and they'll get it down to the platelets. Then they'll inject those platelets into your shoulder, whether it be if you have frozen shoulder or if you have a rotator cuff tear or any of the 3 that we discussed. And these PRP injections will stimulate the growth factor. So growth factors go in there and allow the inflammation to come down and allow the healing to take place at a really high level. So I really love that, especially if you're dealing with a good frozen shoulder condition or a rotator cuff tear. I think it's much better than just sticking a bunch of steroid in there repetitively, or going in and having unnecessary surgery. So, that's what we're going to discuss next, shoulder scoping. I think at the right time and place, it's fantastic. I mean, if you have a labrum tear, we need to repair that labrum. It's really hard to get that labrum to repair with PRP or stem cells, but going in and having an amazing orthopedic surgeon go in there and repairing that and restoring normal stability back in the shoulder is huge. Or if you have a complete tear of the rotator cuff, that tendon's in 2 pieces, hey, you need a skilled orthopedic to go in there and put that back together. And they are wonderful at that. And I applaud them. And I've used multiple orthopedics around the area or the country with my patients and have had tremendous success when we blend both. I like to talk about this with patients. I'm like, hey, if I can get the fibrous adhesion out of the shoulder and prep your shoulder before surgery, then you're going to have a lot better outcome. Now, what I mean by that is that if we can get that scar tissue that caused that tear out of there as much as we can, to where then the only thing that's left is just that tear in your rotator cuff, for example, then he goes in, repairs that, and then you don't have much left underlying, and then you go in and strengthen it, and then there you go. You have a much healthier shoulder post-surgery. So also treatment, physical therapy, strengthening, wonderful thing to have done in the right context. We need to fix the problem like we discussed, then we need to strengthen it. So whether that be calming it down with a frozen shoulder, getting the scar tissue out, then we apply some good eccentric exercises or good exercises for the shoulder, what the physical therapist can do for you. And I believe that in the right context will give you tremendous results. So what I want you guys to do preventative wise, test yourself. If you're not having any shoulder conditions or no symptoms, test yourself. Use that shoulder abduction test. Bring your arm up to the side of your head. You can do it anywhere, anytime. It's a great way to test yourself. And I also want to go over some preventative measures that I like to do. I like to do good ballistic stretching. I think it's one of the best things before you work out. And a lot of athletes and even high level active individuals don't really employ ballistic stretching before they go into the weight room, before they go do a HIIT training class or whatever they're doing. And what I like is good big shoulder circles. So extend your arms out and go forward and backwards repetitively. And that's a great way, and come across your chest. And I believe that's a great way just to get some blood flow and get some good relaxation of the rotator cuff muscles before you go out and use them. So ballistic stretching, warm up properly. And, I'm really excited I got to bring this show to you guys. The rotator cuff is a very common injury, as well as the frozen shoulder. And then, of course, the labrum tears are becoming more and more prevalent, which we need to, get the word out of the right treatment, get the scar tissue out that could be contributing to the labrum tears happening. So hopefully this info was helpful. I really appreciate you listening as always. If you think this information was helpful, please do feel free to pass it along or share it with anyone that it may help. Have a great week. Looking forward to a next show, which we're going to be discussing plantar fasciitis. I believe it's going to be an awesome show and really educational for a lot of millions of listeners out there that could be suffering with that condition. So have a great week. Thanks for listening. Take care. I really appreciate you listening to another exciting show this week on the IDSVIG episodes. For more information, please visit my website at wbsports-spine.com. And if you have any questions you would like answered on the IDSVIG house calls, please visit our website at wbsports-spine.com/podcast. And we love to answer your questions at the end of every month. If you've enjoyed our show, please leave us a review or rate us on iTunes. The higher ratings we can get, the more people we can reach out to and help. I appreciate you listening once again. Take care.